You just joined me as I was looking at the comments that Donald Trump. Has it's still connecting? I saw a heart go.
That was me. It was my
Oh,
heart.
hey everyone, I'm with Dr. Eric Feigl-Ding. He is actually an epidemiologist. He's a man who's actually, studied and has credentials. He's a man who actually took on Big Pharma. And who am I? I'm just an unfrozen caveman lawyer. I married a doctor who's a family medicine doctor who knows Dr. Eric Feigl-Ding, but she's with the kids. She'll be home soon, so you might hear about 800 kids walk in. But there's a whole bunch of news right now, and I was waiting for this, which was Donald Trump and RFK and their pro-death eugenics march, and I'm going to break that down and why I use that very deliberately and specifically, and I think Eric might actually agree. Today came out and very dangerously and recklessly tied my beloved Tylenol. Oh, yes, Tylenol, which actually I like, to autism and said a whole bunch of other stuff. This stuff hurts my brain. So I said, let me just rely upon Dr. Eric Feigl-Ding, who actually has, like I told him right before we went live, he actually has the number one trending tweet on Tylenol. And what Eric said was Tylenol and autism. RFK Jr. and Trump are wrong. The largest and best study in the world in 2.5 million kids found no increased autism risk with, how do you pronounce it?
Acetaminophen or
Yeah, which
paracetamol.
Donald Trump can't pronounce either, and he's the president, used by the mother during pregnancy. All right. So before we get down to the bullshit that Donald Trump said, tell me the truth about Tylenol. Tell me the truth about autism. Tell me the truth about women and moms using Tylenol.
Yeah, so this has been a raging debate for a long time, but it's been settled. Every time there's someone talks about, oh, it must be something that the mother did when, she was pregnant with the kid or something the kid got when they're young. And those people have been searching all the time. And Tylenol was like one of the most common things that people had because moms get sick when they're pregnant. And they have fevers. And it's bad, by the way, to have a fever for too long for your baby. So
Mm.
people were taking Tylenol. But, some of the early studies found that Tylenol increased the risk of autism later. But the problem is, why are you taking a medicine? This is a pain reliever, fever reliever. It means you have an infection, right? It may not be that it's the taking of Tylenol. We call it confounding by indication. It could be the indication that you're sick with something, stomach flu, some other cold virus or some other infection that makes you sick, that makes you want to take the Tylenol. So we couldn't figure out for the longest time, was it taking the Tylenol or was it the reason that made you sick enough to take the Tylenol that increased the risk, right? And so that is a big difference. Is it the underlying sickness or is it actually taking the Tylenol? And the largest studies in the world would help solve that. And the best studies are not just the ones that comparing, your wife versus some other person's other pregnant woman who had then had a kid who then got autism or didn't get autism. The key is to look, actually the best way is to look within the same family and with with siblings who had autism without autism from the same mother. That removes like, oh, that mother had so many different other infections. So this is where the results are from the Swedish study, 2.5 million people, 2.5 million kids, not just 2.5. And they found that there was no increased risk if you specifically compare siblings who had, mother who took Tylenol when pregnant, mother who didn't take Tylenol when pregnant, but same mother. By looking at that, you remove this other, what else is different about the mom, right? And so
So,
those
mom,
analysis,
let me
we
break it
found
down as
nothing.
a layman for myself. Mom takes Tylenol, has baby. Mom, same mom, doesn't
Takes
take Tylenol.
Tylenol, has another baby that didn't have autism. And when you look at that and you specifically do the correlation analysis, association analysis of that, you find that there's no correlation between taking Tylenol and having autism.
Zero.
Zero. But if you do it the wrong way and look between moms, and basically there's so many other differences between families, like what else did you eat? Where else were you exposed to? Where else were you, infected with? All these different things. Then it looks like Tylenol has increased risk. But again, even if it was only a tiny 5%. You cannot be possibly explaining the totality of autism. It's only a 5% risk. with the bad crude analysis, and there's zero increased risk with the correct analysis. And this is where the quality, quality matters. If you have crap studies, you have junk in, junk out, right?
Yep.
Like this is where RFK Jr. cites the VAERS data, but the VAERS data can't tell you anything about vaccines and autism or vaccines and anything. And so this is where it's so much matters. This is the JAMA, Journal of the American Medical Association, the top journal in medicine of the American Medical Association, one of the premier journals, and they published this large 2.5 million person study. Some of the other studies are literally just 1% or 0.5% or 0.1% the size of this 2.5 million person study. So this is a national registry in Sweden. There's no one who escapes being captured. You can't be like too poor or too rich and not get captured. Every single autism is captured in Sweden. And this is where it's systematic. There's no some parents are very concerned and they get an overdiagnosis, or some parents fall through the cracks because they don't have a doctor and they don't get diagnosed at all. That shit happens in the United States. That does not happen in Sweden. So a 2.5 million nationwide study in Sweden where no one escapes being captured, having autism or not, taking Tylenol or not, because everything's electronic medical record, and comparing this kind of like within the mom, child 1, child 2, autism, no autism, Tylenol, no Tylenol. That is the gold standard. And everything else literally are just they're tiny, they're like tiny specks of stardust compared to this major study.
So for clip notes, there is no link between vaccines and autism, bold underline. And if you don't believe Dr. Eric Feigl-Ding, well, here is an OBGYN group leader who literally the president of American College of Obstetricians and Gynecologists said that suggestions that Tylenol use in pregnancy causes autism are, quote, irresponsible when considering the harmful and confusing message that they send to pregnant patients. Furthermore, quote, today's announcement by the Health and Human Services is not backed by the full body of scientific evidence and dangerously simplifies the many and complex causes of neurological challenges in children, which Dr. Ding just spent the last 5 minutes breaking down. Thank you. Quote, it is highly unsettling that our federal health agencies are willing to make an announcement that will affect the health and well-being of millions of people without the backing of reliable data, end quote. Now, before we get into why they would promote, a pro-death narrative, let's talk about the effect. Because I have used the left hook and I have used my writings in the Daily Beast, and I even wrote a piece in the New York Times before COVID talking about the increase in vaccine hesitancy. Even before COVID, you know this because you're a nerd and a doctor, the World Health Organization said that vaccine hesitancy was a top 10 global threat. I read that, wrote a piece in the New York Times, quoted my wife, trying to get people to vaccinate their kids. Now, we have RFK and cranks, and I'm sure you've seen the latest data, came out, I think, last week, that 1 in 6 American parents are not vaccinating their child. And now you have this link, which does not exist, that is being promoted by Donald Trump, RFK, who's not a doctor, and anti-vax cranks between Tylenol that pregnant moms use for pain and autism. Can you tell us about the impact this dangerous conspiracy and bullshit and lies will already have in a vaccine-hesitant America? Talk to me about the damage to pregnant moms and their children.
Yeah, I really struggle with how bad today's fallout was, because I think, first of all, it was a presidential press conference. It was like a 4 p.m., 4:30 p.m. press conference. They stopped the press. All the newspapers were waiting for Trump to say something, and RFK Jr. had a lot of babble in the background, and they just put this out. And of course, people believe it because the maker of Tylenol, their stock fell to an all-time low. So clearly someone is believing this, or else the market wouldn't be reacting. And I think the thing is, when women, first of all, again, fevers in women when they're pregnant with a kid are really bad. You want to avoid these fevers. And if they hear this, what are you going to do? Women already, I'm already hearing from doctors and pharmacists, they're already scrambling. What do I do? I don't want to take this anymore. This is we haven't even hit 12 hours of this news cycle yet, and it's already spilling over because Tylenol is such a everyday household, you know, uh, drug, and like everyone is talking about this. And I think once they now believe the RFK on this, then they're going to believe RFK on the next nonsense. And again, this is one of those things where established medical science believes that this like there is no increased risk, or else we'd be screaming out on the top. And again, Tylenol, there's generics. There's very little money to be made from Tylenol, right? There's only some places that charge $30 for a pill that's inside of a hospital. You can get Tylenol super cheap at pennies. There's no financial conflict here for the most part from any like medical association whatsoever. This is one of those everyday pennies drugs that people should take of whenever they have a fever. Now, it's not good for liver, of course. If you have some liver illness, you shouldn't overdose it. Of course, follow the guidelines. But for like a kid, a mother who's pregnant with a baby, she should definitely be taking this, or at least suppressing her fever somehow. But with without any other context. Because if I'm trying to debunk this, but obviously I
No,
can't.
please.
But I can't debunk as fast as Trump and RFK Jr. spreads this misinformation.
Well, by the way, my cat has come into this conversation and agrees with what you're saying. So Billu is making, and Billu is shameless. He just wants me to rub his belly. So forgive me. I got to do it.
That's all right.
Eric, I
I
hope
need I need an emotional support cat right now at this moment too. If I had one, I'd be petting it right now as we talk too. No, but it's okay. There are people who say, well, there's this review study, blah blah blah, that says that it could increase risk. But I want to point out, just because the right wing is talking about it, if they're talking about it, we have to talk about it a little. And basically, there is
it's
this
the
review
president of
study.
freaking United States, like you said, using his platform to literally promote bunk science that will get people killed.
Yeah,
We have to talk about it.
yeah, we have to talk about it. And so they're basically citing this review paper. This review paper that says, oh, we looked at many studies, blah, 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 blah. Majority of them found increased risk. This is where I'm saying majority doesn't, what is, just because you cite a lot of studies doesn't make it right, because junk in, junk out. Like most of these studies are literally 1% or half a percent or 0.1% the size of this Swedish study. And American studies are inherently flawed because oftentimes, we don't report them. We miss a lot of autism because we have bad healthcare and system. A lot of our medications aren't reported properly. And there's over-reporting of as well, because of some parents who are inherently like very concerned and get their kids tested and tested and tested until a doctor, agrees with them and say, oh, maybe there's an autism because your child is unique and, divergent. But in Sweden, again, 2.5 million kids, the largest ever. Like in America, we don't even have any study that approaches 2.5 million kids nationwide. We don't have a national children's health study. By the way, we almost did many years ago. Who axed the NIH budget recently? RFK Jr. and Trump administration. They Doge axed the NIH budget for and many scientists got fired all this time. So, while we're trying to do more research, we will never rival this kind of
Well,
research that
Carrot, can
Sweden
I
has.
interrupt you for a second? Because Lincoln Square, the account of Lincoln Square makes a really good point, and I try to bring the receipts, and I keep saying this is a pro-death eugenics movement. I'm going to say it again. MAGA is a pro-death eugenics movement. And speaking about pain, I want to bring a receipt during RFK's hearing. With January 30th, where our Maryland Senator Angela Also Brooks, a black woman, took RFK to task for his claim that black people have a stronger immune system than white people, and thereby should receive vaccines on a different schedule than them. And as my wife, who's a family medicine doctor, has repeatedly said and teaches her medical students, is that one of the enduring myths, a racist myth, is that black people have a higher pain tolerance. Literally, this is how almost Serena Williams, the GOAT, died, right? When they're literally asking for pain medication, they're like, oh, no, they're just lying. Oh, they just want the drugs. So put us in this context of black women, right? If they're desperate and they need this pain medication, and now you have this debunked science and this eugenics from this crank, RFK, with his toadies. Imagine how vulnerable, and they're already the most vulnerable population. What will happen to black women?
Yeah, I think black women have very little access compared to white women when it comes to healthcare. Infant mortality is so much higher in African American women. That is well established, well established. And maternal mortality is also higher. Maternal mortality sometimes is, depending on where you are, like 5x to 10x higher than white women. It is an insane amount in some locations, but nationwide is at least 2x higher. So you add in the maternal mortality in pregnancy, infant mortality, and there's so many other medical safety. They need to get checkups. They're not getting their checkups. Like their health is literally on the line when it comes to, you need a lot of checkups because there's so many developmental things that can go wrong during pregnancy and of course during delivery. So I think my worry is this kind of like, don't listen to your doctor kind of approach. Don't listen to American Medical Association. Don't listen to obstetricians. Don't listen to pediatricians. Oh, but
But
listen to
listen to
RFK Jr.
RFK
and
and
Trump.
Donald Trump.
It is madness. Like, people go to medical school, graduate school for many, many years, pay hundreds of thousands of dollars to study for tens of thousands of hours, and then residency training and other postdoctoral research training. And all of a sudden, none of that matters. Mr. Brainworms, who does not understand anything about p-value or epidemiology, is spewing all this nonsense and horse whispering to Trump, who then spews it out into the ether. And of course, the MAGA movement sucks it up, soaks it up, like cult members, and people will die as a result of
And,
this.
and can I,
That's my
I always try to keep the receipts. I've been on this for a while, and the reason why I use eugenics, I'm going to call it. It's a pro-death cult. I've been seeing this for years. People thought I was suffering from TDS. People said, oh, you just hate Donald Trump, or you're being extreme. I said, it is a pro-death movement. They're embraced for mass violence. They're embraced for shootings. They're embraced for anti-science quackery. COVID, where literally, as people were dying of COVID, they said, I don't believe this hoax. Bleh. That's when we should have seen it now. And then I want to remind people what RFK said about autistic people. I'm going to quote him. He said, RFK, a man with no medical degree, no background, a man who loved his heroin, eats exotic animals, had a brainworm, was a predator, according to his cousin. That RFK, who's the director of Health and Human Services, said many autistic children were, quote, fully functional and, quote, regressed into autism when they were 2 years old. And these are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted. Most cases are now severe. 25% of the kids who are diagnosed with autism are nonverbal, non-toilet trained, and have other stereotypical features, end quote. I have family members and friends who are on the spectrum and autistic. I'm like, you clearly have not met an autistic person. And I also remind people that he wanted a registry of autistic people. And I remembered there was another group in history that also had a registry and also had lists of people who were deemed non-functional. I can't quite remember. Dr. Ding, can you tell us?
Does it start with an I and start with an N, end with an I don't
I did
know.
not see where you're going with this, but
I
I
did
think you
not
meant
see where you
Nazis.
went with that
Nazis.
either. Mm.
Nazis.
Yeah, exactly. And this is where, and oftentimes, it was those sick people who then were disposed of first, right? Because they were less useful to the war effort. And
Non-productive, according to Curtis Yarvin and Elon Musk.
yeah. Well, I think this is where it is just insane. Having a registry for that, I think, by the way, I hope everyone takes care of their personal medical records and tries to share as little of it as possible with a lot of these companies. And because these health insurance would love to get their hands on this data. Now, technically, Obamacare prevents them from discriminating based on your healthcare information. Thank God. And we know how many times that almost got repealed, right? But there's different ways of them getting around that kind of into, because now, based on search, the AI and, all the cookies out there on the internet knows so much about you. So, there's still a lot of potential for discrimination of many other sorts and denial of coverage. Because, one thing, it's getting insurance is one thing, because you can't get denied insurance anymore because thanks to Obamacare. But getting coverage for things, oh, you have other extenuating reasons. Oftentimes these algorithms, if you're higher risk and they predict you have less morbidity or like less life years, or they think you're high cost, they're going to try to cap you, compared to someone who's much healthier. And so all these kind of algorithms will play into the. Remember, right now, Mehmet Oz, Centers for Medicare and Medicaid, they actually have a proposal that they will use this AI algorithm, big data algorithm, to decide your health future, whether you get coverage, whether you're denied for claims. All this is being fed, and we have no other ethical moral boundaries other than the AI will decide for you. That sounds like death panels to me, which I'm pretty sure the Republicans used to rail, against Obamacare for. But it's exactly death panels, but it's AI bot, algorithmic driven death panels. So I think that's even worse. But that's what
Sorry,
they want.
sorry about
That's what
that.
they
I had
want.
to let 15 people enter, and I was listening to you and multitasking, as is the way of a dad, as you know. My kids and all their friends came over at 8 o'clock because tomorrow they don't have school. So give me 1 second, and keep talking. But Eric, I want to ask you this: is as we're talking about this, we also saw just recently in Florida, and just to show you how this danger, folks. I always just try to connect the dots because you're the doctor. I've been begging people because I have said on Democracy Ish, my show with Daniel Moody, beforehand when there was no Substack like Sent Daily Beast, that one of the most dangerous four horsemen of the Trump administration, I said, was RFK. And I've been following him and his theories, and the pro-death, anti-science movement and the pro-eugenics movement. And now we see the state of Florida, right? One of the most populated states. My in-laws are in Florida. Talk to us about literally what the Surgeon General of Florida just said about vaccine mandates that you and I took, which is why you and I do not have measles or polio or rubella.
Yeah, so it's this pro-death movement is growing wider. It's more than just RFK Jr. Like Ron DeSantis just recently signed off with his Florida Surgeon General Joe Ladapo, who incidentally was a former Harvard friend of mine, who has gone off the deep end and decided we don't want kids to get vaccines. We're not going to mandate anymore. You can go to any Florida elementary public schools and not have any vaccine. Private schools as well. Florida just does not care about your kids having vaccines before attending school, which we know school is a cluster in terms of infection, right? And so I think that was one of the most insane things. And it also, I think it just leaked out today that Ron DeSantis did not get any whiff or discussion about this other than Joe Ladapo pitching it to him, reportedly, according to news outlets, like the night before. It's like, Joe Ladapo's like, yo, Ron, I'm going to do this. And DeSantis is like, sure, okay. Without any other medical society, asking what does the medical society think about this? What do public health experts think about this? Oh, it's just this one guy calls him up. Okay, let's put it out there. We're not going to mandate anymore, and voila! It is public health policy by pure political, um, I don't the cultish nature. It's whoever
Yeah,
is
it's
heading it in your
it's a
state.
pro-death eugenics cult.
Yeah,
And an aspect of this, Eric, if you can break it down for people, because I need people to know what their whole end game is, right? You need to know where they're going. If you don't vaccinate your kids, Dr. Moneres, who testified, who by the way was appointed by Republicans, she refused to bend the knee. She actually challenged RFK and all this stuff, and that's why he fired her. She says that polio will become great again in America, right? And these people aren't that dumb. RFK knows about it, but he says, "Oh well, natural immune system, the herd mindset." Can you talk to us about them literally promoting thinning the herd and increasing the natural immunity, regardless of how many people die? Because that's what's going to happen, and they know about that.
yeah. So the statement that I have God gave me an immune system, I don't need the vaccines is the most ridiculous. God gave people during the Middle Ages an immune system, and 1 in 3 people died of the plague back during the Black Death, during the Dark Ages, and we know tons of people. The infant mortality rates mortality rates overall for so many different diseases were like 10x higher than what they are. Children, there were entire cemeteries where half the cemeteries or were children because a lot of kids died because we had no cures, we have no preventions for them, and we want to go back to those
Well,
dark
Eric,
ages.
even forget the Middle Ages. My grandmother. I mean, I learned something. This is old school immigrant stuff, but like my grandmother, that entire generation. I'm talking about the 20th century. They were like, yeah, two kids died. We have five. Yeah, like my aunt was like, I had a sister, but she only lived to 3 months old. I'm like, what? They're like, yeah, kids back in those days just used to die, so they used to have a lot, and you had six, and maybe four would live. And I'm like, whoa. So look how far we've come, even in the past 100 years, Eric. Sorry, continue.
Yeah, I know. This is not a Dark Ages thing. We're just saying they're citing stuff that Dark Ages and the last 100 years should have taught us that these are very deadly things. And even if you don't die, you don't want basically to live in an iron lung, right? Or you want to or be, handicapped and survive in a wheelchair like, FDR was put in a wheelchair for his whole life because of polio. All these things, people don't have memory. I think the issue is it's out of sight, out of mind. The generation that does remember are basically very, very elderly and passing away now. But people in the more recent days, the Gen Zs and the Gen X, the millennials, many of them have never even heard of these diseases before because they were eradicated by vaccines, and now they're raging back. And it's raging back. It's causing such a rage right now because these are preventable things. And I'm preaching the choir here. A lot of the audience know this. But what I beg for people to do is to remind your family members who may not be as in tune to the news. Like you're all here because you watch the news, read the scientific literature, follow the medical science, public health science. But lots of people out there don't. They are in their echo chambers. They don't see all these things. They don't see the debunks because the debunks never make it into the echo chamber. You know, what you have to remind them that is these are such deadly diseases that if you don't get out of your cultish mindset, people will die. And I think the people remember, it's not like government control because government outlawed, for example, you cannot put alcohol in your body if you're going to drive. Ooh, big government telling you my body, my choice. No, your choice of anything ends when your choice endangers other people. Like basically not getting vaccinated, spreading infection in a classroom, throughout a mall or whatever, right? Or drunk driving. You have the right to drink alcohol, but you don't have the right to drink alcohol and endanger other people on the roads. If you want to smoke, fine, you can smoke, but you don't have the right to smoke and then puff it in a restaurant and get the bartenders and the waiters lung cancer, right? Or other people on the airplane cancer because you're smoking on an airplane. All these things, your my body, my choice. Tell them this my body, my choice thing is stupid because it's when you're endangering others, you're right to endanger others. You're right. I can't punch you or stab you for the same reason I'm not allowed to drink and drive and run you over and basically endanger you by spreading a deadly virus to you. And I think people need to know that we're in it together. Like we all tell people in our neighborhood, slow down driving here. There's kids here. This is a school zone. There's speed limits. In around, we have to protect our children, but we protect them collectively as a community. And I think this community sense sometimes is completely fallen to the wayside when the MAGA cult refrain is just freedom, freedom to do whatever, freedom to
You said
endanger
something
whatever.
which I want to, you said, oh, I'm preaching to the choir, and I don't think you are, because what I've seen in my own family and what I've seen with educated, I'm talking about super educated, smart people, is that we live in the United States of amnesia. And there's no shared facts or truths anymore. And people don't trust institutions, and just weird shit spreads. And I think MAGA is very effective because they go after kids. And I've seen so many moms say, if there's even a 1% chance that eating Tylenol will have my baby in my belly right now autism, I won't take Tylenol. And I've seen this spread in the wellness communities. I've seen this actually spread not in MAGA. I've seen this spread in upper middle class communities in the Bay Area, the goop communities, the wellness communities, and then it intersects with MAGA and right wing media, right? And then people are so overwhelmed, right? You know how it is, Eric. Well, I don't need Tylenol. And if there's a 1% chance, I heard someone say, which is why I think we have to connect the dots and we have to inform people and we have to educate people. And like you said, people then need to educate themselves and their families first and foremost. You know, Dr. Kavita Patel gave me the analogy because she's like, things are bad. And when I had her on a couple of weeks ago, she says, the first time in my life, I'm telling people not to come to America. Our public health infrastructure has collapsed. This is generational damage. And the advice that I'm giving everyone is like, you're on a plane and there's turbulence. And the flight attendant says, first, what? Put the mask on yourself, then on your children and your family. And she's the only people that you can trust probably the next 6 months is your family med doctor, your pediatrician. That's your front line of defense, right? Get yourself safe, your family safe, get yourself vaccinated. Because look, these people control the NIH, they control the CDC. These are the people who run the Health and Human Services. They've replaced all the experts. They're purging them. They're bringing on friggin' nutters. And Donald Trump today, who's not a president, who should know better, who is vaccinated, spread this nonsense, and literally children are going to die. That's what pains me. Children are going to die. Women are going to die, Eric. It is a eugenics movement. And for those who think it's harsh for me saying eugenics, they literally, I think the 1,300 people are joining us on a night on 8 p.m. on a Monday night football night, because this is important. I want you all to protect yourselves. Measles is great again. Measles has come back. Dr. Monera said polio is going to come back. 1 in 6 parents are not vaccinating their kids. So talk to us about how actually you talked about it a little bit, but if you can make a direct, if you will, link, even if the rest of us are being responsible, I have an immunosuppressed kids. They're also senior citizens. Talk to us about how this actually impacts national health and how that will harm America, because the world will be like, yo, I don't want your measles ass coming to friggin' Finland or Spain or Mexico.
Yeah, that's actually a good point because I could see many countries, once America devolves even further, saying Americans need to get basically vaccinated before they come to their country for these fundamental diseases because Americans will be literally the germ carriers of the world if this keeps going. I think, yes, you're right. It's not just the MAGA sphere. A lot of the online wellness sphere is an echo chamber of each other when they promote things. And I think it's bad. I cannot stress enough because I've seen people in the wellness sphere uh, basically, bandwagon on, say, paleo kind of things, or a bandwagon on seed oil or hydroxychloroquine or ivermectin. And I'm like, I know all of those pretty well. I also know a lot is about seed oils I've tried to debunk, but it doesn't go anywhere because I think the blogger sphere around these wellness gurus are they're paid they're paid salesmen, paid self-promotional people. Us scientists, we're not paid to basically do this. We do science and research. Debunking stuff is not a usual hobby, all right, or nor is our specialty. And so I think people just have to realize, you know, a lie and misinformation, disinformation, especially when it's part of promoting a wellness brand, and all these content creators will go around the world so many more times faster than to debunk. And I think this is where we don't have the infrastructure to debunk all this kind of stuff. And and this is where I think so many people in the next few years, it's going to fall down this spiral. This spiral is going to get worse and worse and worse to the point where this distrust in scientists. Oh, what do you guys know about science, anyways? Blah 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 blah. They'll take any controversy. Like right now, some people say, "Well, there's such a controversy. So many studies found that there was autism risk. So many studies didn't find risk. Oh, we don't know." And it's kind of like climate change, where, well, even though all the best studies and all the most renowned studies in the world found there's climate change is real. Oh, they just seed a little doubt. Oh, but 1 or 2% of the scientists say there isn't. And then the right wing sphere just blows that up because obviously the fossil fuel industry wants to sow doubt. And when people hear that, oh, there's a controversy. No, the medical associations all agree with each other. The largest studies in the world all say there's nothing, but yet the disinformation apparatus will take that little bit of doubt and shred and like blow it up to a proportion of we don't know anything. Doctors and scientists don't know anything. Even
And
though I
also the
tell
grift,
people
Eric,
junk
it's
in, junk
tied
out.
to the grift. It's tied to the grift because if
Yeah.
you see what they're simultaneously doing as they're destroying our institutions, destroying trust in our institutions, destroying and purging actual doctors and experts, they're simultaneously promoting the snake oil, the vitamins, right? Not all vitamins are bad, right? If you notice MAGA sphere, all of them are making money off of this stuff, right? You even had Dr. Oz making money off this stuff. So it always, folks, there's always a
Oh yeah.
grift involved as well. In addition to
Dr.
the
Oz was
racism,
famous. He was famous because if you wanted to get on his show, this is well documented, you would have to pay his side hustle LLC a promotional fee. The green tea, the green coffee bean thing. That it was like basically he had a huge platform. People knew that whatever, if you could get yourself on Dr. Oz show and get mentioned, you've made it. So he basically charges this exorbitant fee. Of course, he doesn't disclose it to his audience. No, I don't know how his TV contract even allowed it, but basically, you have to pay the promotional. There's this side hustle of promoting this, like, this wellness kind of thing, and of course, there's so many affiliate links, selling supplements and all these kind of things. Just to be clear, I sell no supplements. Okay, I have no merch store. I do not take any money from pharma.
my
This
Substack is free. And Eric, shamelessly promote your Substack.
Oh, I have a Substack. Oh, it's just my personal journal, Dr. Eric Ding. Substack.com. But you can find me. The issue, I'm not, I write whenever I get angry, and I've been very angry lately. So, I think lately it's one of those times in which I vent about a lot of this stuff and go into stuff in the more detail that I can't on Twitter per se. But I think it's just so much. I have to just debunk it, because if we wrote op-eds saying RFK Jr. is wrong, literally every single day we would be writing another op-ed, and I think most newspapers and magazines are kind of tired of RFK Jr. is wrong again, because like everyone just says that, right? And like, so I think in order to vent and be more effective and put out the debunk faster, we just have to put it out there, and hopefully, people, the good people who are listening, will keep sharing it with the world and fighting
I think
back
we
as much
have
as they
to.
can.
People have been following me. Like I said before, the 1,400, no, almost 1,500 people are joining us. Don't worry, we're going to have this conversation up in an hour or so. It'll be up on Eric's Substack, which I just shared. It'll also be on my Substack. I again want to implore you. What's common to you isn't common to everyone. The misinformation is so rampant that in my family, I'm sure people in the comments, I'm listening to them, your family members, educated, informed people who literally have never gotten measles or rubella because they're vaccinated are no longer vaccinating their kids. What the right wing has done, very smartly, I should say, in the most evil way, is link anything dangerous to children. People want to protect their kids. So then people say, especially pregnant moms, if there is even a 1% chance that me eating Tylenol to reduce my pain can make my child autistic, of course I want. As we know, especially if you're poor and if you're a woman of color, especially a black woman with racism and racist institutions and racist perceptions, they already aren't given pain medication. Serena Williams, the GOAT, almost died. And so now think about it. All these people are against vaccines. There's no vaccine mandates. Measles has come back. Polio is about to come back. We still have COVID. People are unvaccinated. Our NIH is being gutted. Our CDC has been gutted. Mexico, a couple of months ago, actually had a travel advisory to America due to, of course, the measles outbreak. What is that going to mean? As Americans get more sick, we live in a globe. What's going to happen in the globe? As Eric said, people are going to be like, yo, you can't come to my country unless you show me papers that you got vaccinated. It's going to further isolate America. All our doctors and scientists are being poached by China and Europe right now because all their funding is gutted. Our elders, our seniors are immunosuppressed. They're going to go. Children like my daughter at risk. She's a liver transplant survivor, right? There's going to be mutations, folks. COVID, as you all know, if you've been following the past 2 months, a lot of people have gotten COVID shots, have gotten COVID again because there's a new variant, a mutation. They didn't get super sick because they're vaccinated. But folks, this is what happens. So we're going to make America dumber, more exhausted, more dead, more sick. And the people in charge, that's part of the plan. Because according to Peter Thiel and Elon Musk and the Broligarchy and RFK Jr., hey, we got to cull out the herd, right? We have to do natural immunity. And literally, they believe, like eugenics, the strongest will survive. So, hey, let the kids go. Let grandma and grandpa go. You know what? You weren't strong enough. That's okay. We're natural, like me. And this is going to be a collapse, not just of our healthcare system, but also literally a pro-death eugenics movement happening in real time, which is why I will do as many shows as I can on RFK, the CDC, on vaccines, just to spread the word. Eric, my kids are here. You got to go. How can people protect themselves? How can people get good information? What should people do literally tomorrow just to protect themselves and their families?
Well, first of all, always double check anything. If you hear something RFK Jr. Trump, check with the medical societies, pediatrics for children's health, obstetrics of American Medical Association, American Public Health Association, you know, see what they say. If they agree or disagree, then start actually look at the consensus of what the other experts say. Don't listen to any single expert. I would say don't listen to me alone. I'm just a one opinion. I just happen to be an epidemiologist for last 20 years. I've been whistleblower against big pharma, and I've published hundreds of papers, but minor detail. But look at the actual medical societies and public health societies. What do they say? And then actually assess. If you're going to do your research on the toilet, please tell your friends, do your research. Don't do research with the blogosphere and these promotional people. Look actually at the medical societies and public health societies. And honestly, go look at Canadian Public Health Association, Canadian Medical Association, European Medical Association. See if they agree. If they disagree with RFK Jr., you should probably not listen to RFK Jr. And RFK Jr. CDC, handpicked CDC committees as well. So we're in dark times right now. We have to basically peer review with other organizations. And again, don't just listen to just one person. You can follow me on Substack or Twitter, but I just bring the facts and I just point you, well, let's see what the other societies say, not just our CDC and RFK.
Folks, thank you so much. Lincoln Square has been a fantastic addition in our chat section, along with everyone else. She said you need to move to paid subs. I'm a terrible capitalist, and my immigrant parents cry. I've deliberately kept everything free because I believed an informed citizenry can resist fascism and what I call the pro-death eugenics movement. And I just want people to connect the dots. I want people to be safe. If you have some money, give it to Eric. Eric, shamelessly promote your Substack again.
Dr. Eric Ding. Substack.com. But that doesn't matter. What I care about, share the info on from Twitter, from all these other sources. I'm on Facebook as well. You'll find me there. Share the info. That's what's the most important.
Share the info, folks, especially to those who are vaccine hesitant, especially to, again, this is not just dumb people. I am telling you, and you all know there's 1,500 people watching, some of the smartest, most educated people that I know. I have been shocked to hear what they've been saying and doing. They have vaccinated 2 kids and have not vaccinated the other one. As measles is raging, as there's COVID, as friggin' polio might come back. Don't take my word for it. Handpicked CDC director Dr. Moneris, who got fired, Republican handpicked CDC director, she said she's afraid that polio is going to come back. We're in it. These are dark times. And I'll end on this, people know I'm Muslim. It's okay if you're not Muslim, if you don't believe in God, don't worry. This is just a story. Stories are around for thousands of years for a reason. They communicate truths about human beings and show how we pretty much don't change, regardless of our ethnicity and tribe. But, Dr. Eric Ding, that the story of Noah always amused me, right? Because I was like, at first, if Noah's like, there's going to be a flood and I'm going to build an ark, you'd be like, you're crazy. And then if you notice this old man has a huge ark, you're like, all right, he's crazy, but he's very industrious. And then if you notice all these animals, I don't know, like lions and friggin' gazelles are chilling and going into the ark, you'd be like, this is strange. And then, if the water starts coming and it's at your ankles, you might be like, let me go talk to Noah. And then if the water is at your, hips, you might be like, Noah might be onto something. And I don't know if the water was right here, you'd be like, hey, Noah, I'm going to go on the ark. And in that story, if you haven't read that story, all the people are like, Noah, you crank. I'm gonna steal the land, and they die. And I always read that story. I'm like, this is hyperbolic. And then I saw COVID, and then I'm seeing the last 6 months, and I'm like, I get it, God, I get it. Human beings have always been at a state of loss. So it's one of those situations. Get on the ark, join the lion and the gazelle. For the love of God, get yourself vaccinated, get yourself informed, get yourself educated, protect yourself and your family, and don't take this information for granted, folks. People aren't stupid, they're just misinformed. Explain it to them, connect the dots, and hopefully, you and your family can stay safe. Eric, shamelessly promote yourself as we leave.
Well, I'm Dr. Eric Ding on every single platform, whether it's Instagram, Facebook. I have a lot on Facebook. I don't even post on Facebook that much. I have millions on Facebook, but I want people to just share, the Twitter link. I'm going to post it on more places about the Tylenol stories and many other stories we're going to come. We're going to do a deeper investigation, follow on Substack to my journal. But what matters is I want you to help share this. When you guys subscribe to the emails, share it once I send it out. I'm going to do this whole post later tonight. And back to your point, people will crawl in a desert seeking for water. And when they get to the mirage and realize there's no water, they'll drink the sand. This is from the American president. And then President Andrew Shepard in the movie American President shoots back. No, people don't drink the sand because they're thirsty. People drink the sand because they don't know the difference. And I think it is our job, incumbent ourselves, to tell our family and friends the difference between RFK Jr. nonsense and actual medical research and public health guidelines that the rest of the world follows, except us. So please, make sure your family knows the difference between that kind of disinformation and actual medical research and science that will save lives.
Folks, my kids just came, so I'm going to try to get this out in the next 30 minutes, an hour. If Dr. Ding is able to do a write-up and get it out, then I'll just share it. But there's 1,600 people who are watching. Some people came in late. Dr. Eric Feigl-Ding broke it down. He broke down the study. He broke down why. There's literally no link between Tylenol and autism. It has been tested. It has been proven. And he talked about also the dangers of listening to this quack science. We tried to connect the dots, and we tried to make it a Cliff Notes version, smart but also accessible for everyone. For those who joined us late, it's going to be up on my Substack and Eric's Substack in an hour or so. Please listen to it. Please share. Please be kind. Please be healthy. Please rest. Take care of yourselves. Take care of your families. And please, oh, please don't be an unvaccinated fascist. Thanks, Eric.
Thanks. Take care, everyone. Stay safe.